And I will ask that you keep your microphones on mute when you are not speaking. We will now begin the meeting with a roll call of members.
Thank you very much, Madam Chair. Members of the committee, when I call your name, please do unmute and confirm that you are present to determine quorum. Karen Bishop.
This is Karen with the City of Chandler.
Thank you. Santiago.
Santiago Cornejo, City of Tolleson.
Thank you. Melanie.
Tony Gilbert, Melanie is here.
Thank you. Seth.
Seth Dyson, City of Surprise. I'm present.
Thank you. Jerry.
Jerry Guajardo, City of Avondale.
Thank you. Eliana.
Present.
Thank you. Susan.
Hi, Susan Hallett with City of Phoenix, present.
Thank you. Cindy Severino as proxy for Mary Lynn Kasanik. Lisa Maddox.
Lisa Maddox here from City of Peoria.
Thank you. Chair Penatescu.
I'm here.
Thank you. Kira Peters. Jason Matthews as proxy for Sean Pierce.
Present.
Thank you. Chris.
Kristen Charlo, City of Tempe.
Excellent. Thank you. Amber. Christian.
Christian Zabrowski, City of Buckeye.
Excellent. Thank you very much. Did I miss anyone who's a member of the committee? Okay, thank you very much. Madam Chair, we have quorum.
Great. Our next item is a call to the audience. This is the opportunity for the public to comment on items that fell under MAG's jurisdiction that are not on the agenda or that are on the agenda for discussion and not action. Members of the public could submit written comments via the MAG website 2 hours prior to the meeting. Amy, do we have any written comments for this item?
Madam Chair, we have not received any public comments for this item or any other item on the agenda today.
Awesome. Thank you. Our next item is the approval of the August 8th, 2024 meeting minutes. I understand we do have some changes. Are there any other members of the committee who have questions or comments for the minutes?
Madam Chair, to summarize the changes that we've received to date, we will be fixing this the spelling of Karen Bishop's last name and to reflect that the number of units developed is 157, not 147.
Thank you. Is there a motion to approve the minutes?
I'll make a motion to approve. Melanie from Gilbert.
Second?
This is Karen. I show second.
Great, thank you. We have a motion from Melanie and a second from Karen. We will now have members take part in the voice vote by turning on their cameras and unmuting their audio. For those who cannot or do not want to turn on their cameras, we will conduct a roll call vote. Members, please leave your cameras on until after the roll call vote. Can I have a voice vote from the members? Those in favor say aye.
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 Those opposed say nay. Amy, do we have any roll calls that we need to do?
Yes, Madam Chair. Jerry, how would you like to vote, please?
Aye.
Thank you very much, Madam Chair. The motion passes.
Great, thank you very much. So during our last meeting, we heard an update on the Home TA program. I would like to thank those who were able to attend the technical assistance event on August 13th. Sapna joins us today to offer the latest update and seek the committee's action on the requests that have been received. I can't wait to hear. Sapna, please proceed.
Thank you so much, Chair Penatescu, and thank you to the members of the committee. I'm excited to present this update on the Home TA program, and also noting that this is an item that's for vote for approval. And so I'll just, if we can go to the next slide. I can go over the background of the program, thanks to a philanthropic grant from the JP Morgan Chase Foundation. This home TA program was shaped and developed thanks to your input and that of the Human Services CIC Committee. And we've been hard at work since the beginning of this year, developing the inventory of topics through the survey that you heard about, and issuing an RFQ for consultants and experts to deliver that home technical assistance for preserving and developing housing that is affordable and that is customized to the needs of our cities and towns and tribal nations in the region. So as you know, this committee approved the selection of the Matrix Design Group to provide expert consultancy to the cities and customized to their needs, and we approved that in June. And we were excited to offer a program in August 13th specifically, that helped launch the application for requests for the cities and towns, and also featured both regional, state, and national speakers and experts on the kind of technical assistance that will be available for application. And thank you, Chair Panatescu, for opening that event. And the event was held virtually. We had great participations from cities and towns and tribal nations in the region. And then we're excited to announce that while we opened the request, the application process on August 13th, we gave a month for our member agencies to apply, and we received 15 applications from cities and towns in the region. And we worked with an evaluation committee composed of key stakeholders in the region, in the housing department, in the housing sector. And so we had a multidisciplinary team that included representatives from the Arizona Housing Coalition, ASU's Morrison Institute, Vitalist Health Foundation, and a retired housing expert to discuss the requests that we received and prioritize them. Thanks to their input, we developed a prioritized list, and that is what you'll be voting on after my presentation. What I also wanted to announce that we also received some excellent news, which is an additional grant of $150,000 that MAG will be able to deploy directly to supplementing the existing $360,000 that we had to provide the technical assistance. So now the total amount that will be available for technical assistance, and we're really excited about that, is actually $510,000 that will provide it to provide assistance, customized technical assistance to our cities and towns. And it will go a long way towards participating and helping in this effort to grow housing availability in our region. The grant came in from the Nina Mason Pulliam Charitable Trust, and it's a one-year grant. And we're just very excited and delighted to share the news that 100% of the grant will go towards the technical assistance. So that is one of our important updates, besides the fact that we received 15 requests for assistance. And so, as you can see on this slide, if we can go to the next slide, please. So we received the technical assistance request. We have not ranked them, but prioritized them according to a very...
Am I the only person who's not seeing slides?
Madam Chair, I can see the slides.
Yeah, perhaps if you click on the Zoom icon, there'll be a second window that will feature the slides.
Yeah, so Christine, I was on meeting and I had to click over on Meg's screen, and then you can see the slides, which I wasn't seeing originally.
Yeah. Okay, let us know if we can assist you further with that. But if you can see the slide, we're actually now at the September timeframe, and we are right on schedule, the same schedule that we developed earlier this year. And this is where we have that prioritized list. And because we have received additional funding, we're really excited that we will be able to assist every single applicant. And we are working, we're going to be working with the applicants. Many of them had indicated that they were interested in group learning And so we're excited about the process of virtual and in-person group learning, which allows us to stretch these funding dollars even further. And so not only can we provide more assistance, we also are excited about the fact that this assistance will be wider ranging and more cities and towns are going to be able to benefit from it. And so in some cases, we had applicants who indicated they were interested in the group learning. We might be able to offer an additional topic to them as well for technical assistance. So this is an update that is going to help propel this project forward and have it have even more impact in the region. And we're really thrilled to share that news with you. And now we're going to be starting in October, which is less than 2 weeks away. We're going to be working with the experts at the Matrix Design Group to shape this technical assistance with the input of the applicants to see what works best and what works on whose schedule and how we can assist them in the next year. So as you can see from the slide, that the timeline indicates that we will be delivering the technical assistance starting this October through next October. And I just want to emphasize that this process is going to be a two-way process in that there is a delivery of technical assistance, but we're also going to be learning from our partners, the member agencies who are participating in this process. And we're going to make sure that we're learning the lessons about what kind of both opportunities and obstacles there are in preserving and developing housing that is attainable, and how that learning can be communicated and disseminated to other cities and towns that could benefit from it if they express the desire, but also throughout the state. The nature of this Home TA program is innovative. And so not only are there opportunities to disseminate some key learnings in the state, but I think we know that there's applications that are national, and that is something that was very, very attractive and interesting for our funders. So we're really excited that this program is not only innovative, but it has both, besides being regional, it has state and national implications. And that's what we're going to have in a final report. So if we can go to the next slide, please. And I'm not sure I'm seeing the next slide, but what the next slide would have, yes. So this is the process that we were going through. So as you know, on August 13, we had a virtual event with great participation, and we made the forms available. 15 requests were received, and we had the meeting with the evaluation team. So we're presenting to you this prioritized list for your approval. And the next step will be to issue task orders with Matrix Design Group after we have communicated and worked closely with the applicant cities and towns to determine the best approach, both in terms of meeting with them and their specific technical assistance requests, and how best Matrix Design Group, but also our community partners that can also provide assistance, and also the data analysis on our end at MAG and how that can assist our member agencies. And throughout this process, as I mentioned, as we're learning from this process, if we learn, we expect to learn quite a bit, but we will make sure that our learnings are disseminated to member agencies that may not have had a chance to submit a request, but we will make sure that that is communicated as well. Next slide, please. So this concludes my presentation, Chair and members of the committee. And as you can see, that this item is on your agenda for approval. And I turn back the mic back to you, and I'm available for any questions you might have.
Thank you, Sapna. Are there any questions from the members? And Sapna, was there a slide of the prioritized list that I might have missed? Maybe we could go back to that for the motion if there was.
So thank you, Chair. We don't have a slide in this presentation, but that prioritized list was communicated to the members via email.
Okay. Any questions from the members? All right. Hearing none, is there a motion to approve? the prioritized list?
I'll make a motion to approve. Melanie Gilbert.
And Chair, I'll second that motion. Susan from Phoenix.
Okay, all in favor?
Aye.
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 Any
Aye.
opposed?
Madam Chair, if we can do the roll call, please. Looks like we have 3 members whose cameras are not on. Chris Charlo, how do you vote?
Yes. Thank you.
Eliana, how do you vote, please?
Oh, I'm sorry. I had said aye. Apologies. I'm having some issues here.
That's okay. Thank you. And Jerry, how do you vote, please?
Aye.
Thank you very much, Madam Chair. The motion passes. And
Excellent.
sorry, and the prioritized listing is also available on the MAG website for this meeting. So if anyone has difficulty accessing that or finding it, please let me know and I'd be happy to send that to you directly as well. Thank you.
Thank you. Okay, next up, it is helpful to learn about the needs of the communities we serve as we recommend regional activities. The Maricopa County Public Health Department is here to share the results of their coordinated community health needs assessment. Tiffany Tu and Jessica Francis, I think, are the 2 that are here to join us to present the results for the committee's information. Tiffany?
I'm going to pass it over to Jessica to kick us off.
Thank you so much for that introduction, Christina. Hello, everyone. My name is Jessica Francis, and I'm joined here by Tiffany Tu from Maricopa County Department of Public Health. And we are here to present on the results of our 2024-2026 Community Health Needs Assessment. Next slide, please. So our agenda for today, introduction of our team and the county. Next, we'll be doing a brief overview of the CHNA and survey results. After that, we'll be diving into some data topics of interest. Afterwards, we'll discuss next steps that the county is going to take once we have completed this community health needs assessment. And at the end, we will have some time for questions. So we do ask, due to the limited time we have to present, that if anyone has any questions throughout the presentation, if you can note it down, and then we'll make sure to address them at the very end. Next slide, please. So for introductions, next slide, please. We'll be introducing our Synapse CHNA team. These are just a few of the core members who work on the CHNA year-round. So I myself, Jessica Francis, am the Community Health Assessment Coordinator on the team. I am joined again by Tiffany Tu, who is our Community Health Impact Specialist. We have another Community Health, her name is Pearl Gore. Our main epidemiologist for the CHNA is Hamza Rafiq, and our Communications Coordinator is Lihem Iyasu. And last but not least, we have a fearless leader, Annie Damude, who... Next slide, please. So as you can see here on the screen, MCDPH and the Maricopa Association of Governments have very similar mission and visions. Our vision is to create a healthy and thriving Maricopa County for all. Our mission is to increase the quality of life for our residents by collaborating with the community to develop and implement strategies, programs, and services addressing the emerging and changing needs of public health. And on the right, you can see 6 of our core values listed here. Next slide, please. We'll be going over some high-level details of the CHNA, please. So conducting a CHNA for the whole entire county, Maricopa County, is no small feat and wouldn't be possible without community collaboration. On the slide here, you can see that MCDH is the convening agency that supports and the Health Improvement Partnership of Maricopa County on the right. So the Synapse Coalition is a group of hospital partners and federally qualified health centers that work together to collaboratively collect data that informs the needs of our community through this community health needs assessment. The Health Improvement Partnership of Maricopa County is a collaborative effort between MCDPH, public entities, and private organizations that work together to address priority health issues identified from the CHNA, and we address them through a community health improvement plan. So through this collaboration, we are able to conduct countywide CHNAs as the Maricopa Health Matters. Next slide, please. So what is a CHNA? A community health needs assessment is a comprehensive data collection of a community to identify strengths and health priorities. So for the Public Health Department accreditation standards, by doing the CHNA, we're able to identify the top priorities of the community and identify which ones need to be addressed through our community health improvement plan. Additionally, we're able to get our Synapse Coalition on board, as a CHNA is also a requirement for nonprofit hospitals and federally qualified health centers to meet standards set by the IRS and HRSA. Next slide, please. So for our 2023 CHNA, we had 3 primary data collection tools, which is our community surveys, also the CHNA survey, the focus groups, and the key informant interviews. So for the purpose of this presentation, we will be focusing mainly on data from the community survey. Please. You'll just have to hit next 2 more times. There we go, perfect. So CDPH was able to collect one of the largest and most representative survey results keys of success. We were able to have clearly defined participation goals and routine monitoring each week to make sure we were on track to meet our set targets. We engaged local community organizations to assist with collecting data. This year we were grant funding for 23 community organizations. We made sure to mobilize public health staff, our volunteers through our Medical Reserve Corps, and even university students to collect data through events and take plan. Internally, we had regular groups for our multiple teams we had regular meetings for all the groups that were involved in the CHNA work. We had an online and a physical toolkit for community partners to be able to promote this survey in a streamlined and easy way. And then we also made sure that any participants and community members could sign up for survey updates so that they could understand what is happening with the data after it's collected and how were we addressing the top priorities identified from the data. Next slide, please. So on this slide is an example of how MCDPH reported our weekly results out to the community. Some of the categories listed here on the screen are just a few of the categories that we were monitoring each week, and this is actually an example from halfway through our data collection. We had a more comprehensive data monitoring tool that was developed to ensure that responses were representative of the Maricopa County population. So for any of these categories, if we saw that our numbers were lagging, we made sure to pivot with our data outreach and collection and make sure that we were getting those numbers up. Next slide, please. This slide here shows the increase in participation from survey participants throughout the years and how we were also able to provide more survey features to make the survey more accessible throughout the past CHNA cycles. So as you can see in our first ever CHNA cycle in 2012, we had 973 participants, and we were able to increase that by 589% in the next cycle to 6,708 participants. And each subsequent cycle, we have seen a positive increase. From the last cycle to this cycle, we did see a 27% increase from 14,380 participants to over 18,000 participants this year. Next slide, please. And now we're going to get to the CHNA survey results. Next slide, please. But right before that, we just want to touch on results from the previous cycle to highlight the significance of the results that we had this cycle. So in the 2021 CHNA survey, we did see underrepresentation from those who identified as African American or Black, Hispanic or Latino X, male individuals, as well as youth and seniors. So highlighted in each of the blue box, the blue color, the blue bar graph, represents the percent of the actual county population in 2020, whereas the orange bar graphs represent the percent of survey responses we collected in 2021. So for those categories, you can see that we did not collect a representative sample. Next slide, please. Versus in our cycle this year, of the 18,297 survey participants that we were able to collect data from, we were able to get more comprehensive data and more accurate data. So with our gender identity reporting, This looked like having a more accurate gender identity question that helped that from which the results accurately reflected the makeup of our participants. So this year, we additionally were able to collect data on those who identified as transgender man, transgender woman, or non-binary and gender queer. Next slide, please. And then this year, with the help of our MCDPH team and those grant-funded community partners, we were also able to collect more representative samples for additional categories as well. And then if you can just hit the next button 4 times to highlight those categories. Again, the dark blue color represents the percent of CHNA survey respondents for this cycle, while the lighter blue represents the percent of the actual population of that group in Maricopa County. So as you can see, for our American Indian or Alaska Native group, our Asian group, our Black or African American group, and we were able to collect even more than more than the percentage of the actual population of that group in Maricopa County. And then we highlighted the Hispanic or Latino X group as well, because compared to the last cycle where we were only able to get 19% representation, we were able to this cycle. For our age demographics, while most of our participants were between the ages of 18 and 65, we were 18 to 65, we were also able to get participation from those under 18 years old and those 60. For our sex demographics, very similar to previous cycles, 30% identified as male and 68% identified as female. Next slide, please. Able to collect for our priority populations and per public health region of the county. This regionalized approach helped us ensure that we were able to have not only a representative sample of the county's population, but also make sure that we can tailor our outreach and sources to needs in each of our regions. Next slide, please. So now we're getting into some of the overall CHNA survey results. As you can see here, when respondents were asked which health for, anxiety and depression were the top 2 responses, followed by high blood pressure, chronic pain, and diabetes. Next slide, please. Another question that we wanted to highlight, we also asked about community strengths. So when respondents were asked to rate their community assets, the highest rated were access to parks and green spaces and opportunity to participate in religious or cultural events. And then affordable housing and access to quality public transportation were most likely to be rated as poor. And these are available on our overall county survey profiles that we have available on our website at maricopahealthmatters.org. So these are just snippets, but you can always go onto the website to see more. Next slide, please. And so now that we've reviewed some overarching results, it's time to dive into some data topics that we collected that we believe may have been more interest to this group. So for this section, I will be passing it off to my colleague, Tiffany.
Thanks, Jessica. Can you guys hear me okay? Okay, see that head nods. All right, so my name is Tiffany Tu, Community Health Impact Specialist here at Maricopa County, and I'm happy to take us through some of the data topics of interest. So let's dive right into that. Next slide. All right, first we'll have a look at mental health. Next slide, please. From our 2023 CHNA survey, respondents were asked which health issues impacted them or the people that they live with or care for the most. Out of 47 total health issues, anxiety and depression were identified by the community as the top 2 health issues. Among respondents who identified themselves as experiencing homelessness or having a disability, over 50% indicated that anxiety and depression were health issues. This quote on the bottom comes from our 2023 CHNA survey. To summarize, the respondent shared that mental health care system is inaccessible, expensive, and burdensome, forcing patients to manage both administrative tasks and their own medical decisions. Next slide, please. Exploring mental health further, we also asked survey respondents to rate their mental health, such as your mood and how you handle stress day to day. We saw that over half rated their mental health as fair or poor. To summarize this quote, the respondent expressed that with mental health issues at an all-time high, it's very difficult to find help, especially for conditions like anxiety and depression, which is a significant issue across all communities. Next slide, please. Now let's take a look at substance use. Next slide, please. From our CHNA survey, respondents were asked which health issues had impacted them or the people that they lived or cared for. Among respondents who identified themselves as experiencing homelessness, over 3 in 10 indicated alcohol substance misuses as a health issue. Among respondents who identified themselves as having a disability, over 1 in 10 indicated alcohol substance misuse. To summarize this quote, the respondents shared that their community requires increased efforts toward mental health support and substance use prevention, highlighting the need for strong ongoing support for individuals to address the holistic impacts of these issues. Next slide, please. Now let's take a look at housing. Next slide. From our survey, respondents were also asked to rate elements of their community for where they lived. Among respondents who identified themselves as experiencing homelessness, almost 6 in 10 rated their access to affordable housing as poor. Among respondents who identified themselves as having a disability, over 50% rated access to affordable housing as poor. To summarize this quote, the respondent shared that they're too young to qualify for senior services and feels financially strained, working full-time yet unable to afford healthcare, and emphasizes the need for affordable housing in all communities, not just Central Phoenix. Next slide, please. Now let's look at access to healthcare. Next slide, please. From our survey, respondents were also asked what would help you get the care that you need. Of all respondents, over 2 in 5 indicated that having evening or weekend appointments and lowering out-of-pocket costs for services would help them get the care that they need. To summarize the quote below, the respondents shared that the healthcare needs need to be more affordable, as high insurance costs are forcing them to compromise on both healthcare options and food choices. Next slide, please. Now let's look at heat-related illness. Next slide, please. From our survey, respondents were asked which health issues impacted them or the people that they lived with or cared for. Among respondents who identified themselves as experiencing homelessness, about 13% indicated that heat-related illnesses was a health issue for them. Among respondents who identified as having a disability, almost 1 in 10 indicated heat-related illness. To summarize the quote below, the respondent shared that there is a critical need for more safe spaces for unhoused individuals during the hot summer months, as they are at risk of heat-related illnesses and deserve human basic decency and access to essential services. Next slide, please. Now let's look at food nutrition. Next slide. From our survey, the respondents were also asked over the past 12 months, how often had you had enough money to pay for essentials? Among all respondents, about 3 in 10 reported that they sometimes or never had enough money to pay for food. To summarize this quote below, this respondent shared the hardships of living in Scottsdale on $17 an hour, struggling to afford healthcare and basic necessities, often having to choose between food and medicine each month while relying on inexpensive and unhealthy groceries. Next slide, please. Finally, let's look at transportation. Next slide, please. Survey respondents were asked to rate elements of their community for where they lived. Among respondents who identified themselves as experiencing homelessness, almost 2 in 5 rated access to quality public transportation as fair, while among those who identified themselves as having a disability, almost 2 in 5 rated their access to quality public transportation as poor. To summarize, to read the quote below, it's from our CHNA survey participant, and it reads, "We need to seriously invest in public transportation and stop building and expanding new highways, as the air quality here is horrible and causes and aggravates asthma. The roads are also extremely dangerous, and the road design causes deadly crashes and pedestrian deaths. We need narrowed streets, wider sidewalks, protected crosswalks, and protected bike lanes everywhere." Next slide, please. All right, now let's take a look at next steps. Next slide, please. So you might wonder, where do we go from here after we've collected all the data? So by weaving together all the collected data pieces and community input, this has really helped MCDPH identify the top health priorities, which includes mental health, access to healthcare, access to healthy food, substance use, and housing homelessness. We've started the process for developing a community health improvement plan, otherwise known as a CHIP, which is completed every 3 years, similar to the CHNA. The CHIP is also a requirement for accreditation through the Public Health Accreditation Board, or FAB. The purpose of the CHIP is to coordinate, target resources, and define actions taken by community members as well as organizations to ensure that we're promoting health and increasing the quality of life of our residents. Next slide, please. We're also currently working on developing a community health needs assessment dashboard, which will include information on our methodologies with data collection, as well as all data related to our selected priorities. This dashboard can really be used by the community to stay informed about our health needs and can help community partners like you make informed decisions and effectively allocate resources. So stay tuned for that launch of the dashboard in early October. To learn more about what community members shared about the health topics that we reviewed together today, you can explore the full survey report, as well as focus groups and key informative interview reports on our website at maricopahealthmatters.org. You can also find more information on our regional and city profiles and really learn more about the Maricopa Health Matters Collective on our website. Next slide, please. So that brings us to the end of the presentation. We're happy to take any questions if there's any. Thank you so much.
Thank you, Tiffany and Jessica. Are there any questions or comments from our members? Seth?
Thanks, Madam Chair. Thank you so much, Jessica, Tiffany, for the presentation. I was wondering, I know different hospital systems have to do their own community health assessments, I believe, as well. So do you work together, or how do you share data, information? Do they coincide with your work? Do you all work together, basically, is my question.
Yeah, that's a great question. So that is actually our Synapse Coalition, which is a hospital and healthcare, a group of hospital and healthcare partners that come together to collect data to really inform the needs of the community by doing a community health needs assessment. So we currently have 10 total Synapse partners, which include healthcare facilities as well as FQHCs. And so we work individually with these partners to really help with building out their community health needs assessment as a part of their requirements by HRSA and the IRS. We are working together with the coalition to really work on building shared priorities, because we know that there is a lot of overlap among hospitals, right? We see that mental health is a huge issue in the community, as well as chronic disease. So with this huge overlap, we really want to work with the Synapse Coalition and our community partners to have a shared priority that we can all address together without, building or just collaborate together to really have more resources to address the top health needs in the community. So hope that answers your question.
Any other questions?
Yes, Chair Penasescu and Maricopa County Public Health. I had a question on Susan Hallett with City of Phoenix. I had a question on an earlier slide. You had a slide where you kind of shared some of the demographics of the respondents, and I can't, but you also shared some specific populations. And so I was curious a little bit about those. I was really, first of all, it's exciting to see us actually identifying populations by, key areas of veteran status, LGBTQ, that type of thing. I don't know if you can go back to that slide, but if you can further explain those percentages, I want to make sure I'm not over, understanding, or rather understanding what those percentages mean. You know which slide I'm talking about?
Is it the slide where, is it possible to go back on the slide perhaps? Yeah, I think that'd be helpful.
Keep going. It was towards the front.
Might be the 11th slide, Christina.
Sorry, everyone.
I know we went through this quickly, so it's
This one.
best
Oh,
to
go back. 2 more. Go forward. There you go, right there. So by population characteristics, I was just curious. Is that suggesting that 36% of the surveys have been responded to by veterans? Can you just explain that data for me, please?
You can go ahead, Tiffany.
Yeah, so that's correct. So so the percentages that are listed means that among those who are living with disabilities, 50%, we were able to outreach and collect survey responses from that specific population. So that demonstrates that.
Out of that 6723? Oh, no, that's still what's still needed, what you've received thus far.
For which part?
For those, for that data, you were able to reach 36% of individuals who identify themselves as veteran status, 42% identify LGBTQ. But if you're at 55% of your goal of the 67, still needing 6723, this would suggest that 36% of about 6,000 surveys and 42% of 6,000 surveys. Do you see? I'm trying to connect the numbers.
So I just want to let you guys know that this is not the most updated infographic, as this was something that we used throughout the outreach data collection effort. Yes, the 36% shows, yes, towards our overall goal of 15,000. So we're 36% of reaching that. I'm sorry, can you please repeat your question? I'm trying to understand.
I think I might be able to assist. So based on our regionalized approach, so for our total number of 15,000, we had a goal of, for example, just throwing out there, like if our goal is to get representation from 800 veterans, for example, then this graph will be showing that we are 36% of the way towards our goal.
Oh.
So we set a lot of our goal like census data, and if we didn't have census data, we used of the population in this region of the county, we set a minimum size of, I want to say 50, so that once we reach that goal, we report out the data in a disaggregated by any individuals who identified as that group.
Okay, and I apologize, one last question. So this is, you're at 36% of the goal that you set, right? And the goal is to do outreach to X number of veterans, not necessarily the survey responses that you've received.
Correct, that is correct.
And then, you know, you may not have this readily available, but what were your goals in these three areas? And if that's not readily available, that's fine. I guess my general statement is just appreciate that you're kind of drilling down and looking at some special unique populations that I haven't seen a community survey. You know, a lot of times community surveys will come back with who has responded and how do they identify, but you guys are going after these populations, which I think is fantastic. So just kudos. Sorry for the long-winded question and
no, that was a great question, Susan. Thank you. Because that's an important clarification.
Yes, we did go through this presentation quickly, so completely understandable if you have any questions as such. And I did hear you mention, Susan, you're from the city of Phoenix. I just want to let everyone know again, on our Maricopa Health Matters website, we do have profile the overall county for each region, and also for I believe our 15 cities that we got the most responses from. So the city of Phoenix does have its own profiles for of the residents of Phoenix. How did they respond? So if anyone was interested in that as well, just wanted to put that out there.
And that's maricopahealthmatters.org?
Correct.
Yep.
Okay. Thank you. Any other questions? Are you looking for volunteers to participate with the CHIP? Or are you going to have regular ongoing meetings?
Oh, yes. So we just kicked off the CHIP on September 4th, I believe, and we just started forming our subcommittees. If there's anyone interested in joining the CHIP and seeing what priorities we have and getting more involved, definitely you can check out on our maricopahealthmatters.org website. Again, we have a page on the Health Improvement Partnership of Maricopa County. They're the ones who set the quarterly partner meetings. It's 4 times a year where you meet up to work on the community health improvement plan. And in between for each health priority, there are subcommittee meetings. So we can provide, I'm not sure if there's a follow-up email, but we can definitely provide information so that everyone from MAG can see where to find out more information and where to sign up if they're interested.
That would be great. Thanks. I participated with the CHIP work groups in the past, and there's some great ideas that take place there. So, and a real opportunity for innovation in the sector. So I highly recommend maybe delegating some staff to participate to keep people engaged and fresh. All right, well, with no other questions, I'll thank you, Tiffany and Jessica, and we'll go ahead and move on to our next agenda item. During our last meeting, we discussed options to the process for developing the annual allocation recommendations for the Social Services Block Grant. A number of committee members volunteered to meet as a work group to develop a recommended process for this committee's action. The work group met last week. I want to thank everyone who participated. Amy St. Peter will now offer the work group's recommendation.
Thank you very much, Madam Chair and members of the committee. If we can go to the next slide, please. So this is just a quick reminder in terms of our general timeline. We are working with you very collaboratively and with our Human Services and Community Initiatives Committee to determine the process and to get input on what that process can include, what's helpful to you in order to develop those allocation recommendations. Between next month and the end of the calendar year, then we'll be conducting that process and seeking your approval, your recommendation for approval on those recommendations that will go to Management Committee and Regional Council in January for final approval. We'll then send it on to the Arizona Department of Economic Security. They'll run their own process, which includes public input in April, and then they will finalize those by next May of 2025. You can click one more time, please, Tyler. So that's where we are right now. We are determining that process. We are eager to be able to do that with your input. If we can go to the next slide, please. As our chair mentioned, the work group did meet. I want to thank all of the members of the work group. There's some really good conversation there. We reviewed the data that we have received already from the Arizona Department of Economic Security. That's been provided to all of you as members of this committee. We did have some additional data requests, mainly around the outcome measures and how does DS measure impact. Well, and just wanting to get some more consistent information across the 4 categories. Again, those 4 categories are older adults, people with disabilities, people with developmental disabilities, and then adults, families, and children. We had some agency information, for example, in the area of adults, families, and children, but not in the other areas. So we're hoping to be able to obtain that from DES. I am working very closely with our contact, and she is working on that right now. We hope to receive that in the next few weeks. We will be convening the work group again. If anyone else would like to join, please let me know. We'd love to have you participate. We'll look to schedule that meeting towards the end of October to allow DES some time to be able to share that data with us from that latest request. We'll come back to you for action then with those draft recommendations in November. It'll be late October, early November. We want to try and avoid the holidays with Thanksgiving coming kind of mid to late November. And then we'll be scheduling a meeting with the Human Services and Community Initiatives Committee then for early December, maybe mid-November. So this is a sequence of events, and we're eager to be able to undertake this work with you and then to be able to provide those final allocation recommendations in January to MAG Management Committee and Regional Council. I'd like to pause here for a moment and see if anyone has any questions or any input. Okay, if we can go to the next slide, please. That does conclude my presentation. Madam Chair, the floor is yours.
Thank you, Amy, and thank you for the work that you did to get that information from DES. I think it was nice to see. It's the most we've had so far, so it is encouraging to see the needle moving on that request and that relationship. Thank you for what you're contributing to making that happen.
Thank you very much, Madam Chair.
All right. Let's see. I think.
Sorry, if we can go back one slide, Tyler. This item is for action, please.
Okay. So is there a motion to approve the recommendation of the work group? that schedule?
So moved.
And a second?
I'll second,
Chair,
only
second.
because I wanted to be the first. Melanie did, but I couldn't get my thing off the button. So I wanted to beat all of the motions today. Just kidding.
Ah, so close.
I think you're in a second as well.
We have a motion and a second. All in favor, say aye.
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 And any opposed?
Madam Chair, we do have one roll call vote. Jerry, how do you vote, please?
Aye.
Thank you very much. Madam Chair, the motion passes.
Awesome, thank you. All right, next up, the Regional Human Services Assessment. Has everyone seen the email that was shared last week inviting the Human Services Committee at MAG to participate in a survey as part of the Regional Human Services Assessment? Yes?
Yes.
Has everyone taken it?
Yes.
Does anyone need me to forward it to them? Awesome. Okay, Amy's going to give us an update. I'm really excited about this.
Thank you, Madam Chair, members of the committee, and thank you for those who have completed the survey. This committee has offered a number of responses so far, so really excited for that. Thank you so much. Your input is really critical to this process. If we can go to the next slide, please. So MAG itself has been around since 1967, so more than 50 years. The Human Services Division has been around for almost 50 years. So over that time period, we've undertaken a number of really impactful activities in very close partnership with you. You as a member agencies really drive this work. You help to keep it relevant and responsive. So these are examples of some of the major milestones that we've seen in the Human Services Division since 1976. This committee, along with our Human Services and Community Initiatives Committee, were the first two committees in the division. So you've been around for the longest. You've done some really great work over the years. And then in 1995, our work shifted a little bit to include more of a focus on human services transportation. In 1999, our work really expanded to include very direct activities and responsibilities in addressing homelessness as well as domestic violence. In 2008, we actually won the national award for the best plan to coordinate human services transportation among urban areas. So very excited about that. It was really our long tradition in working with our human services partners that really resulted in that recognition. It was the fact that we're not just addressing transportation, we're doing so through a human services lens. So thank you for making that possible. In 2010, it was your interest, your concern that resulted in the development of Age Friendly Arizona. That's our statewide network to better connect older adults with people of all ages in their communities. That started off regionally, and it started off really in this committee and in the Human Services and Community Initiatives Committee. Just with the last project, for example, through our Rural Transportation Incubator, we're able to provide, just through that 2-year program, 60,000 rides, even during the pandemic. We were able to deliver more than 5,000 home delivered meals. We created the state's very first interactive and centralized inventory of all human services transportation providers. So your work has been impactful and is making people's lives better, not just throughout this county and through this region, but throughout the state as well. In 2021, we came together again to develop Pathways Home. That's our regional homelessness action plan for local and tribal governments. When the Continuum of Care came to MAG in 1999, it was very much a regional effort, and it's still a regional effort, but the requirements from HUD have become increasingly technical and complex, and we needed to hit the reset button on what is the regional response to homelessness, and that's what Pathways Home represents. And so you were instrumental in the development of that plan, and we'll be coming to you soon with an update on that and additional opportunities for you to engage. If we can go to the next slide, please. So because we've been around doing really good work for a long time, we want to take a moment just to take a step back and make sure that whatever we're doing here at the regional level aligns with and promotes what you're doing at the local level. The best regional plans and activities are really grounded in that local work, and you're key to helping us know what's needed and what are the opportunities in the human services landscape when operating, particularly at that regional level. So we've developed a human services assessment process. You see those 4 steps in front of you. The listening tour and the survey are underway currently. If I haven't yet reached out to you to schedule an interview as part of that listening tour, I will, but if you'd like to reach out to me, that'd be even better because I'd love to come out and meet with you and talk with you about what are your priorities and how can we best assist you. So those interviews are underway and will continue throughout the end of this calendar year. The survey is underway. It will only be underway through next Monday, through September 30th. So if you haven't yet completed that survey, please take a few moments to do so. I did just send out that link again today. If you haven't received it for some reason, please let me know. I'm happy to send that to you directly. And again, this committee is one of the top committees to provide responses so far to that survey. So thank you for your very good engagement in that effort. Starting in January then, we'll be shifting from data collection to data analysis. We'll be analyzing the outreach data to determine what are the trends and gaps in addressing human services at that regional level. We'll also be developing with you a mission statement for the Human Services Division and a corresponding committee and staffing structure that supports achievement of that mission. So your voices will be really important. So for example, so far, according to the survey results, housing is one of the top issues that you're interested in. We want to make sure that we have meaningful engagement with you to address your housing needs and those housing opportunities throughout the region. Domestic violence is still a key concern. Mental health is an area that's of keen interest according to the survey results, but that's a relatively new area for MAG. As we just saw in the Maricopa County Public Health Department survey results, mental health is absolutely an issue when you have the majority of people saying that their mental health is fair or poor. There's a lot of opportunity, a lot of need to be able to address that together on a regional basis. So we look forward to undertaking the outreach, that analysis, and that development of a new structure with you. And it could just be refining the current structure or validating it and helping to direct activities in a more actionable way. You can go to the next slide, please. These are the examples of where we are reaching out to. We are reaching out to the MAG Human Services committees. We're also touching base with the Regional Council Executive Committee to make sure that our top leadership and in terms of the MAG structure is on board and supportive of these efforts. Reaching out, of course, to our intergovs. Our intergovs are really key to helping us understand what are the nuances of what we're hearing. Our funders are particularly important in human services. Out of all of the teams and divisions at MAG, the Human Services Division is the most grant funded. We rely on grants. We're very thankful to our philanthropic partners and look forward to their influence to their perspective as we undertake this assessment as well. And then, of course, our community partners. We simply could not do this work without the close collaboration of particularly our nonprofit partners. And there are other partners as well who are very important, such as our academic institutions and other community-based agencies. So we're reaching out to them as well. In the first email that went out, I think we reached over 2,500 people. So we've reached out to a lot of people, hoping to hear back from a lot of people as well. Next slide, please. Tyler, if you can go to the next slide, please. There we go. These are the next steps, literally and figuratively. We are seeking feedback from you and are thankful for your time and your perspective on this effort. I will be reaching out to schedule and to conduct those interviews with you. Please do feel free to reach out to me and let me know when you're available. I'd love to come out and see you. And then if you could please, you hopefully did receive that survey link today. If you could send it to anyone else within your agency or among your community partners who are important to your work. If you could please share that, highlight it, you could promote it really broadly, that'd be great. We'd love to be able to get feedback on how folks would like MAG to engage in the landscape of regional human services. We can go to the next slide, please. I think that might be it. We can go back one, please, Tyler. I'd like to pause now and see if you have any questions or input. That concludes my presentation. Thank you very much, Madam Chair.
Thank you. Yes, some of you might remember before COVID, right before COVID, we were about to do a group exercise where we looked at all of our community assessments and tried to identify common threads and identify priority areas for the group to work on to give us meaning. I especially appreciate the slide that you had, Amy, that listed sort of the progression. I think that underscores where we are right now. It's an exciting time. This committee has birthed a lot of other work groups that continue to do really important work on behalf of our region for transportation for elderly and disabled, domestic violence victims, and homeless individuals. So, so where do we go next from here? Where do we see the greatest opportunity to put our heads together and collaborate on system change? So it's exciting. That survey is important. And this is the way that we're going to continue or carry out what we had started thinking about doing before COVID. So thank you, Amy, for your support. Any questions, comments? Seth?
Yeah, thanks, Madam Chair. Amy, just a quick question. Is it okay to submit more than one survey per municipality if our transportation team, all that? I assume so, but just didn't want to mess up the data.
No, no, please. Madam Chair, Seth, and members of the committee, yes, please, that would be fantastic, because different people within your organization will have different perspectives, and it's important to understand all of them. So thank you for that.
And along that note, I think that the value of doing that comes in a lot of times in working in this committee over the years, ideas or topics would arise for discussion at this group level, but then there would be like a work group that already existed for that. So it sometimes felt like our conversation got shunted off to for that group to decide if it was important to them or if they would have that idea on their own to do something about it, and our efforts sort of stalled out. So this will be an opportunity to reinvigorate that. The more the merrier. Awesome. Well, thank you, Amy. And so next on the agenda is a request for future agenda items. Is there any issue of interest that you all would like to have considered for discussion at a future meeting?
Madam Chair, Madam Chair, looks like Melanie has her hand raised.
Sorry,
Thanks, Melanie.
my buttons are not very good today. Actually, it's a follow-up to the last one, Christina, with what you had mentioned about getting together again and looking through needs assessments and things like that. So are we still thinking that that still may be something that comes up, but we're going to wait for all the feedback of the review of the survey information to see if that is also still a trending thought to see where direction that we would go next?
Amy?
Madam Chair, Melanie, and members of the committee, yes, absolutely. We're actually considering, and for those who have been on this committee for a long time, you might recall that we used to have an annual retreat along with the Human Services and Community Initiatives Committee. And so we've just started some preliminary discussions to explore that concept again, where we would bring together both committees. We would take a look at possibly the results of the community outreach, both through the listening tour and through the surveys. We would take a look at the early analysis around the topics that were rising to the top there, and to be able to identify those trends and gaps with you, and then to identify some actionable strategies that both committees could work toward in the upcoming year. And so we would be bringing together other data. We would want to work very closely with you to identify what kinds of data, information, speakers, topics are of interest for you at that event. So we would be building that with you and looking tentatively at the kind of February, March kind of spring timeframe for that event.
Seth?
Thanks. Sorry, I'm speaking a lot today, but future agenda item, I think to follow up with the mental health component that was talked about. I think for me and for us in Surprise, we're trying to figure out how we as a municipality can help in that space. So maybe a future agenda item on maybe from NAMI or whoever is kind of the expert. How can municipalities aid their communities with the mental health pressures? And maybe there's some best practices out there. Maybe we've already done a forum that I've not been a part of, so I don't mean to redo anything if we've already done something, but I know that's probably a lot of work, so it doesn't have to be like the next meeting. So maybe at the first of the year, something like that, but I'd be very interested in that.
Yeah, I would like to agree with that, Seth, and also add, I recently actually shared on LinkedIn too, an article that I read about ghost networks for mental health services. And so maybe a discussion on mental health, the mental health landscape and what we're experiencing too, so that we can talk about that more as a group.
It is almost Halloween, so good point.
I hadn't heard that term before, Ghost Network, but I've experienced it. So I guess it's good to know I'm not the only one.
Madam Chair, staff and members of the committee, actually, I just received today some great information from the city of Tempe that they pulled together. And speaking about what is the role of local government in addressing mental health issues, the city of Tempe has a great roadmap for that. And I'm hearing more about the city of Chandler's great efforts in using mental health teams. And so if any other communities have mental health roles, activities, initiatives underway, it'd be great to hear about those, particularly as we build out what that agenda item looks like. It'd be great to lift up and to promote the great work that is already underway, and then to explore as a committee what if there is possibly a regional role in that, or just even cross-fertilizing from one community to the next. Thank you.
Any other suggestions for future agenda items?
Amy, I just wanted to ask if you would share that information from Tempe with us.
Yes, happy to. Thank you.
My favorite part, does anyone have any brief updates or news to share with the committee? I should add, if you have questions for one another, if we have questions for one another, it would be better if we could reach out to them after the meeting, since we haven't agendized specific items. But if you hear something come up that you'd like to put on a future agenda, now would be a good time to mention that too. Any
Madam
good
Chair,
news?
I have a couple things to share.
Great, Lisa,
City
go
of
ahead.
Peoria. Yeah, I just wanted to let everyone know that we host kind of a mini Project Connect here, and it's called the Hope Event. It's the Homeless Outreach Providers Event, and we're hosting that on the 3rd, which is a Thursday, from 9 a.m. to 2 p.m. at the Rio Vista Recreation Center. And we welcome anyone who is unsheltered or at risk of becoming unsheltered to the event. We're going to have about 40 providers this time, so we've increased the services that we're able to offer to people, and now we just need a better showing of participants there, and we know they're out there. So if I'm happy to share the flyer and to have everyone push that out to anyone that you think might need services and could find their way to Rio Vista that day, we'd be happy to help them that day with all sorts of connections. And then the other thing, I don't know that Emily brought this up when she sat in for me at the last meeting, but I also wanted to let everyone know that we have also joined the Hand in Hand program along with Surprise. And so we're really excited about that partnership. We think it's going to be great in helping us communicate across our sister cities here and, you know, really tackle things together in a more successful way. So I just wanted to let everyone know we're on board there.
Thank you, Lisa, and that's a good reminder for me. That was something that I had asked to be on a future agenda item, is the Hand in Hand program, so that we can all learn more about it.
Thank you.
Anybody else?
I'll share
Tomorrow.
one.
Oh, go ahead.
October 5th, we're going to host a free legal clinic services, City of Tolleson, at our new Civic Center, 9055 West Van Buren, 9 to 5 p.m. There'll be a group of volunteers. Volunteer attorneys will be helping with healthcare power of attorneys, general durable power of attorneys, living wills. I can send a flyer if you guys would like, just to kind of share with the team. So if you guys know anyone that needs those services, they'll be providing them free of charge to the community.
Great, thank you. Tomorrow's the big day for Goodyear's Go and Grow event. We have 28 exhibitors representing not-for-profit or public education institutes and career and technical schools, as well as employers who are actively hiring and have tremendous education benefits. The goal being to be able to achieve a debt-free education and improve your ability to have a sustainable income. So that event is at Goodyear Rec Campus, and it starts at, I think, 11. If you go to goodyearaz.gov/go and grow, you can find all the exhibitors and details. Anybody else? Last call?
We are actually Gilbert's doing its first official housing needs assessment. We already kind of had it in the works before the TA stuff came out, but just if anyone offline wants to send me an email, if you used a consultant that you really liked or had success with, we just want to making sure people are aware of our RFP. So if anyone has any thoughts and wants to shoot me an email, that would be great. Thanks.
Wonderful. Well, thank you everyone for attending today. Currently, the next meeting of the Human Services Technical Committee is scheduled for December 12th at 2 p.m. But are we going to cancel that, Amy?
Madam Chair, thank you for raising that. We are looking at scheduling the next HSCC meeting in late October or early November. So we will be reaching out to you with a request for your availability so that we can determine quorum. The purpose of that will be to move forward with the SSBG allocation recommendation so it can go to HSCIC before the end of the calendar year. Thank you.
And then the reward for your flexibility in October will be no meeting in December.
Yes. Thank you.
Awesome. Well, with no further business, I'm going to go ahead and adjourn the meeting. Thank you all.
Thank you, Madam Chair. Thank you, everyone. Great to see you. Take care.